of healthcare workers, but also as leaders in different functions and roles. And from here, we can do what is required to catch up on this virus that is running very fast. For those who are not infected yet, protect them. And for those who have already infected, which are still the majority are our colleagues in hospitals, doctors and nurses and lab scientists, as well as pharmacists. It's affecting almost everyone, biomedical engineers. So we're going to do all we can at all levels using the best science available in the world to make sure we treat them. You know that this virus doesn't have a specific treatment or vaccine, but at least we have reached out to all the most advanced scientific discoveries to make sure we apply them here. And as we speak, last night we received monoclonal antibodies treatment. It's not just big quantity, but it's going to be significant. I'm sure the clinical team is using it as we speak. Today we are going to receive vaccines that are the most advanced. They have been used before in Africa, in the United States last year, in Uganda. They have shown to have very high efficacy. Once you take it within just hours, it can already start to have an effect, boosting immune response. We have acquired antivirals. We're getting more and more. But Marburg is a virus you generally, in the past, have been managed by treating symptoms, by supporting the patient with fluids, managing all the high fever and severe headache and so on. So we want today to present to you what is being done and to make sure we are all together. Most of you are fighting at different fronts. We have those who are in treatment centers. There are others who are in these affected hospitals who are hardly hit by this situation. But also we have community and family members that in a way or another are affected, especially those of health workers. So I would mention maybe 5 points very quickly before I give more time for you to interact and exchange. So it has been 8 days since this virus was confirmed, and we really want to thank again our colleagues at University Teaching Hospital of Kigali, Sashika, who were the first one to ring the bell that they're seeing something unusual and triggered the collection of samples, testing, and which later on became this virus confirmed for the first time in Rwanda. So that helped also to trace back, going to the 2 ICUs that were interconnected with linkage, with tracing, and the contact tracing, treatment, community awareness, and looking at the tools we can apply are the things we're doing. But more importantly is to hear from you what else can be done in now and in the future. The level of infection prevention control in our hospitals, are they optimal or can we do better? The level of surveillance we're applying, is it optimal or can we do better? But more importantly, the enemy we are facing today, do we understand the physiopathology and how it affects us? And can we support each other, even explain before it gets to affect more facilities? So I can specifically speak about the virus. I've been reading about it in the past, but I can tell you that it's associated with the highest mortality than any other virus in the world. It's in the same family with the virus you've heard about, Ebola virus disease, which actually it's currently more manageable with a vaccine and therapeutics. And they're both known to be fragile until they enter the body, and they quickly develop and multiply until they affect different organs, the immune response. They paralyze the reaction, the antibodies response, and they are also known to go through 3 phases of infection, or I would say clinical presentation. Phase one is with the incubation that you know, incubation period for most of viruses, it's days to 3 weeks. So also Marburg is known to be taking time for some people, 3 days to 21 days without symptom. But generally for patients we've seen here in Rwanda, they have been presenting symptoms within the first 10 days. And symptoms, when they start to appear, they come very quickly and aggressively. It's called a fever disease, a fever virus, because viruses are not known to have very high fever, but Marburg, as well as the same family of hemorrhagic viral diseases, they are presented with very high fever. And once fever comes, with severe headache and pain, fatigue, general, sometimes it can go as quick as 24 hours to destroy the entire system and affect multiple organs in a short time. This is a situation we've been seeing, and that's why monitoring symptoms, it's a matter of minutes. Once the first symptom presents, you have to act extremely fast. Otherwise, it reaches the phase 2, where the internal organs are affected, the gastrointestinal system, and it leads to sometimes irreversible complications that those who are managing patients will probably explain in detail. So we're trying to be as clinical as possible, since we are talking to professionals, but also we're not giving alarms that it's not true. This is true, that it's a virus you can prevent by avoiding touching surfaces, blood, fluids, and that's why applying these measures of protection and washing hygiene, sanitizer, we have sanitizing facilities, is extremely important for anyone, even if you don't suspect the presence of this virus. So we've seen this in big hospitals, in ICU specifically, but we may see it in any clinic, public or private. That's why we are all here to discuss on how we take high precautions. Everyone consulting your facility, make sure you have your gloves and make sure you control this to protect yourself, but also your next patients. So the last phase 3, is very typical to hemorrhagic viral diseases, where bleeding and other complications leading to losing lives. So we've read this in literature in the past, but now we're seeing it in our context, in our clinics, in our hospitals. It's sad to see that, but we can. The only thing we can do is to handle it quickly and support those who are affected, and learn from there for any other threat that may come in the future. This outbreak, similar, has happened in our region, and not actually many years back, only last year. A few months ago was in Tanzania, in the Kagera region. It has happened in Uganda, it has happened in Equatorio, in DRC, So we live in a region where these viruses have been moving, and that's why we must always be ready at all fronts. And it doesn't prevent that one outbreak happens with another one, because even as we speak, we are facing two, Mpox and Marburg. But let's contain these two before any other threat comes, but we can also stop it before it even comes. So this is the commitment we have as a team, as colleagues, but it will depend on how we collaborate, share information, and also alert that may trigger a detection and response, like the colleagues at Sashika did for this outbreak. To conclude, I want to highlight the one tool, very important tool to stop any outbreak, is vaccine. So with vaccine, you can stop any outbreak in a short time. That's why COVID-19 ended. I mean, at least the phase one, active phase, and now we're back to work when the whole world was grounded. Without vaccine, we could have been or remained in that situation of lockdowns where no one's flying. Same for Marburg. With these upcoming vaccines arriving today, we will be able to protect the healthcare workers most at risk for Marburg, but also other groups, frontliners, and anyone who has been in contact with a positive case, known as ring vaccination. So we don't have many doses, just a few, but we have prioritized those most at risk so that they can comfortably continue doing their job without fear and without also being a problem in the eyes of their patients, in that we may be getting infected in these hospitals. So we must bring back this situation where patients are comfortable, but also healthcare providers are also comfortable vis-a-vis to these viruses and outbreak. So the numbers are known. I mean, we put them public every evening, but it's very unfortunate that we've lost such a big number of our fellow colleagues, but also community. And we want to do all we can to prevent further infections and death. 41 people confirmed, 24 still in treatment, 12 deaths. Some good news, of course, 5 recovered. We wish others more will be recovering out of these 24 still in treatment. And we have also those who have tested negative for first test, that today we may see if they have also cleared the virus. So we also take this opportunity to thank you, everyone who is contributing to prevention and treatment of fellow colleagues. So I'll pause. Blaise, can you mute a bit? Thank you. Blaise. So that was my few points I want to highlight. There are 2 questions that have been asked by different people. One is, where is this virus came from? I think the media will keep pushing on where the virus came from. Others asking what's the results from sequencing and genotyping. And it was actually unfortunate that they didn't ask more about what are you doing to treat those who are sick, or how far are you going to stop this virus. So we've been focusing on these last 2, stopping the spread and saving lives. But knowing where it came from, how did it start, what are the sequence of events, the historical review is also something we're working on. But the priority for us is that we don't lose any life, can prevent death, and also not having further cluster of infections. So we will be briefing you more about the tracing of contacts and infections. But since we have only 1 hour, I've already taken half of it. Let me pause here and get your feedback and comments. Merci beaucoup. Murakoze cyane, bibazo mushobora kubibaza buri wese mu rurimi yisangamo. Thank you. You can ask your questions in any language you feel comfortable. Merci.
Thank you.
Merci. Back to you.
Thank you so much, Honorable Minister, for those elaborative discussion and introduction. So we really want to encourage everybody to be better organized, as I said in the beginning. Kindly raise up your thumb or your palm so that you can be allowed to ask a question. And then we also encourage that people can type the questions going on so that we capture as many questions and interaction as possible. Lastly, before I give the shot, we encourage people who are asking questions really to be straight on point so that we give as many people as possible and the opportunity to interact with the Honorable Minister. So thank you.
Murakoze Honorable Minister, mwaramutse?
Deje Gisenyi.
Yes, nitwa Oreste Tuganeza, ndi umuyobozi w'ibitaro bya Gisenyi. Nagira ngo manze nshime iyi opportunity muduhaye kugira ngo twinteracting, ariko tunashima intambwe igihugu kigezeho cyane muri mu bushobozi bwa laboratoire, kuko iyo tutagira ubushobozi yenda tuba tuvuga izindi nkuru. So nagira ngo nifuza yuko nsabe yuko mu rwego kugenda going forward twashyiraho system ya multi surveillance, bikanajyana no ku testing cyane izi ndwara ziri za major concern. Ko ntekereza ko ubwo buryo tubushyizeho nkuko turimo tubikora uyu munsi bika routine, National Reference Lab ikabidufashamo, maybe you can anticipate future outbreaks. Hasigaye twese we are committed to serve and to prevent preventable death. Minister.
Urakoze, nahita ngisubiza. Iyo system irahari yitwa CRVS, igeze ku gipimo cyiza, n'imibare yayo twatangiye kuyikoresha. So utaha twazabereka how it captures mortality and also abavuka. But yes, it's available. It's very new, but it has reached at least a completeness of 90%. We'll be sharing through kuyikoresha muri context kureba how mortality changes over time, and if it can be a trigger of any outbreak detection. Thank you.
Hello.
Oui, André.
Oui, Honorable Minister, murakoze kumpa ijambo. Nitwa Andre Gitembagara, ndi umuyobozi wa Rwanda Nurses and Midwives Union. Nyakubahwa Minister, turabashimiye kuri inama muduhaye, yari ikenewe cyane. Numvaga gishaka kuvuga cyane kuri izi outbreaks zombi ari Marburg na Mpox, ariko cyane banza kubashimira kuri izi measures zagiyeho za epidemiological control. Ziragaragara ko mu by'ukuri biriho bigabanya cyangwa se bizagabanya ubundi bwandu bushyashya. Cyakabiri, nyakubahwa Minister, turabashimira kuri distribution ya PPEs ziriho ziraboneka mu bitaro cyane mu bigo nderabuzima ntabwo birakunda. Ejo twakoze inama n'abaforomo n'ababyaza bahagarariye abandi mu nzego zose. Ngiye kubabwira bimwe mu bibazo batugejejeho kugira ngo turebere hamwe niba dushobora kuba twayibonera ibisubizo.
Birimo ubuziranenge buke. Uravuga ziriya zari zihari muri covid kandi zitakoreshejwe kuko the needs zitari zigihari. Ndumva ariyo message washaka gusobanura. Thank you.
Yego, murakoze cyane. Numva gisubijwe. Icya kabiri rero cyari ko muri izi centers za treatment twashyiramo abantu bafite experience. N'ikindi gihe bizabaho twaba dufite teams zaba trained ku buryo twabaze twafektayo kugira ngo dushyiremo abana benshi n'abana bato bakirangiza ishuri baba exposed kuri outbreak ishuro ya mbere. Hanyuma icya gatatu ni iki cy'amashift nacyo nakivuzeho. Icya kane kwihutisha result. Icya gatanu ni iki kijyanye na preparedness muri health centers. Hanyuma icya gatandatu no increasing awareness mu ba staff, ko bagaragaje ko usanga aba staff umwe ava muri service imwe akajya mu yindi uko abonye. Kera twajyaga tugira ikibazo cyo establishing relationship iri hagati y'indwara yishe umuntu no kuba yayanduriye mu kazi, ariko mvuganye na CEO Regis yambwiye ko ibi bintu byumvikana dukwiye kubidekarara nka working accident ku buryo byibuze families zizabona ibigenerwa umuntu waguye mu kazi. Numva ari icyo ngicyo ngira ngo muzadufashe kugishyiramo imbaraga kugira ngo mu informing hospitals zidekarare working accident kuri bano bagenzi bacu. Nibyo bibazo twabashije kuroreva. Ibindi bisigaye nyakubahwa Minister, I think you are doing better. Courage. Natwe nka health providers we are supporting you to end these outbreaks. Thank you.
Thank you very much. Murakoze Andre Kitembagara uyobora urwego rw'abaforomo ababyaza nuko yakusanyije ibibazo byose, putting all these questions together. I noted eight questions and requests. One regarding the protective equipment that must reach all health facilities. So this is well noted. We will see if there is any gap in distribution or any other area where these have not been reached. But we can assure you that we have enough PPEs, and they should be used across to protect healthcare workers. Munama Tribugire, we have our command post daily. We'll cross-check and make sure this is addressed if there are still gaps. Training of young providers and getting them exposed. So most of our health professionals are generally young, but we always learn from our seniors. So the observation that majority are young, especially in this front line response, is well noted. So we're going to see when Lucien Washira kuri mute, please. We're going to see where more senior expertise can be added. But I want to assure you that the treatment center we have, the main treatment center, at the beginning it was in the mobile treatment center built in South, in Nyamata. But now with the new treatment center, much bigger, we have even increased the treatment capacity. We have highly trained personnel. I think we'll be happy to follow up with you if the observation is still the same, maybe early days or depending on which treatment center or isolation center. I'm happy to follow up with you after this meeting. Namenya neza aho bavuga niba it's a specific site. Limiting a shift duration, this is also well noted. Ndayigeza kuri treatment team niba bari kuri line, Dr. Eric Serian, Dr. David, Dr. Menelas, they will feel free to make comment kuri ibibazo kugira ngo bize kumvikana neza. So result lab to reduce the turnaround time for results for those in isolation or those with presented symptoms. Yes, this is very important for us. Yesterday, we managed to find a way to multiply by the testing capacity or testing labs by 5. We are going to have a lab able to test in each province. effective from tomorrow. So I think this is going to help to accelerate return of results. As you know, there are no rapid tests available on the market for Marburg, so we are using PCR, which it takes time. But we're activating multiple PCR labs across the country as the needs for testing is increasing. Preparedness trainings in all health centers. This is very important. I agree with you. We must get ready at all points, not just hospitals. So this afternoon, we are meeting all local leaders, including health facilities, to make sure preparedness is going to everywhere we are ready, even in areas we are not yet affected, but we have this capacity and we have the tools necessary. In terms of barrier, I think this is in terms of safety and caution. As you know, most of these diseases, people are infected during barrier and when the body are being handled, either at family or facility levels. That's why in terms of barrier, there have been specific measures. But what we'll do, as per your request, is to make sure the tests are prioritized according to the urgency of barrier plan and also the support that is required. Supporting families of who lost their, especially healthcare workers at frontline. I 100% agree with you. This has already been discussed at the leadership level, and we expect in coming a few days, actually a more comprehensive guide on this, both on those who are at very high risk and those we lost, and how we can support their families and at the government directly, but also social security package that, as you called it, working accidents. So ibyo birateganijwe, tumaze iminsi mike kandi byari byemejwe n'inzego zose tegereje ko tubishyira mu ngiro in few days. So tuzabamenyesha, ntago biri butinde, byari byamaze kumvikanwaho ko dufasha aba ndetse n'ukuntu iriya miryango yabuze abayo nayo yahabwa ubufasha, ndetse n'ibijyanye ibigenerwa umukozi wahuye n'impanuka ndetse akaba yahasiga n'ubuzima. Icyo cyizweho mu minsi ishize na guverinoma, special steering committee iyoborwa na nyakubahwa minisitiri w'intebe. So it has been already addressed. So I think implementation should be soon. So I think I addressed all your questions. Ibisubizo byose mwabajije byakusanyijwe na urugaga rw'abaforomo n'ababyaza. We appreciate your work and we thank you so much. Kandi namwe twongeye kubihanganisha yuko specifically mwabuze, twese twabuze, ariko mwebwe by'umwihariko hari benshi muri mwe bitabye Imana bari ku kazi ndetse bakinarwaye, kandi twijeje ko turabaha ubufasha bwose bushoboka kugira ngo bakire, n'abitabye Imana bafashwe, imiryango yabo ifashwe. So twakwakira ibindi bibazo, we can take other questions. But in the chat, I have several questions. Moderator, Dr. Muranga, if you allow, I will also have time to go through the chat.
Yes, actually, Honorable Minister, thank you so much. That was what I was going to say, that to be fair, then we address a few questions that has come into the chat. I'm not sure if you captured them or if you want me to summarize a few.
Yeah, if you summarize, it will be helpful.
Okay. Yeah, I'll capture. You may not have captured everything, but some of them really they look similar in different parts. So in the chat, there was a question regarding reinforcing testing capacity, especially in the referral hospitals. And I know that there is something ministry is being done that you will probably clarify on that. There is a scientific question if somebody can address if a person comes on triage and found positive and tests positive for malaria, so meets case definition, that means suspected, but tests positive for malaria, does that person go on to test for the virus? And that's a scientific question and challenge. There is also a question that it's a wish, saying that is it possible to map the spread of the virus and be reported on daily reports we get from MOH, and that the person asking questions says that would be help to know the areas that are most affected and focus the prevention strategies and control measures. There is a question which I think already that the ministry and RBC are working tirelessly and the hospitals, putting those exposed in quarantine for at least 21 days as a recommendation from WHO. Somebody asked that question, but Honourable Minister will clarify what is being done. There is also somebody who expressed to get more clarity on the vaccine and what type, how is it efficacious, and who are going to get it. That was also a question that was asked. And lastly, a person asked a question that people who think they have futures or who are worried, they come to the hospitals and put those they find that at risk, and they were wondering, is there a possibility to send mobile teams to find them home and test them home instead of coming to health facilities? Those are the first set that I captured, Honourable Minister. If you can run through, then we'll take other more. Thank you.
Thank you. Very, very good summary. Thank you, Doctor. I will start with reinforcing testing turnaround time result in referral hospitals. This has been already presented to us by the heads of teaching hospitals in Kigali, who are actually attending our daily brief. So we take this as an important request, and that has to be addressed, particularly for those who have to continue providing care or who have to know how their treatment can be organized. Regarding malaria, co-infection or possibility that, the symptoms for Marburg disease, viral disease, are very much similar to malaria in the first week of infection. That's why we are very much cautious about making sure any presentation like this is not missed. So we strongly recommend that if you think it's malaria and you treat malaria, we should not forget that Marburg might be also present. So malaria positive is still suspicion, is still highly possible that Marburg could be also present. Both could be present, or one or the other. So we're much concerned with Marburg, but also malaria as well. So the answer is yes. Even if malaria is positive, that person still needs to be tested and screened for Marburg. I think there is a case definition that our colleagues at RBC specific province or district or zone. This is an outbreak that was detected in very specific hospitals, 2 hospitals. And what we're doing now is to trace the contacts of the first cases we detected, which some cases might not be within the hospital or staff of the hospital necessarily, but they are still, at least all we have traced are linked in very close contacts. We are still at the first generation of contacts from the first cases, which gives hope that it's not a regional thing or a district thing, but is more of a cluster with networks that we are following. So in that case, you will not be saying this district is red or the other one is red. I've seen a map circulating, and sometimes even being used by some institutions. But I want to say that if a contact traveled from Kigali to Rubavu and is traced and contacts of also tested, it doesn't mean Rubavu became an epicenter and a new cluster. It's still the cluster we are tracing. And if you go to put some district in that zone, Rwanda is a very small country where someone can move from one place to another. I think you would be misleading with that map. That's why I wouldn't say that we show areas or not, but rather we keep tracing on our contacts. They are still a manageable number, and so far is still concentrated in close contact of first patients, which unfortunately is in our hospitals and within specific department. Self-isolation, I think the question was self-isolation for 21 days. If you are close contact, yes, we also recommend that. Sometimes it's not, compliance is an issue. So we have changed the way we address isolation and quarantining. It will be more strict. We have started and we will be doing it more actively than asking people who have been in contact to self-isolate, because sometimes symptoms appear abruptly and can cause damage in few time. So we will be isolating close contact, highly at risk, in red in specific areas. Sibyl, can you mute? Thank you. In terms of vaccines, I think there are different vaccine candidates. Thank you. But there's one vaccine that is most advanced, and that's the one we're receiving today. We'll be issuing a communique about it. It has been proven to be the most advanced, or probably the one that is proven to have worked before, used before, with good safety and even efficacy at that level. So we've been working closely with WHO and the institute that has worked on this vaccine for some time. So we will be announcing details about the vaccine, but it is called, it's an institute, it's called Sabin Vaccine Institute, that if you want to read about it, we can also check that. But as I said, the vaccine is already can start to provide some level of protection after 2 days of injection, and it's one injection type of vaccine. Some vaccine you take 1 or 2 injections. For other vaccine you can take up to 3, but this is one single injection. It has been used in other outbreaks and has proven to have very good results. For those who want interested to read about it, we'll be sharing some of these papers to you through your different groups. So I think the question was if there is any other vaccine, advanced vaccine, are we going to use it? Yes, of course, we are not limited to one vaccine. As far as we get good results, we protect ourselves and our providers. We take that as an opportunity, and the vaccine hesitancy or vaccine issues that have been there before is probably not something we have in Rwanda. As kids, we've received so many vaccines. They have helped a lot to reduce infant mortality and improved life expectancy. And these current outbreaks can only be managed with such tools, with vaccines. You can stop every single case. You vaccinate the ring all around, and even if they get contact, they will be protected, at least at a very high level. Same for providers. If you are in ICU today and you receive vaccine, you will be more comfortable tomorrow, because if the Marburg comes again or any other virus, you will be protected. So we'll be looking at these options and as fast as possible. Of course, there is a protocol about the vaccination, because we have to contribute to the final phase of trial in science, which was the only condition that we're discussing, negotiating with our partners to access this vaccine. It went so fast. Normally in other countries, like in Uganda, it took several months or weeks, but here it's only 8 days since the vaccine, the virus was confirmed, until we received the protocol approved and also vaccine delivered. So by this evening, we will have them here, and by tomorrow, vaccination will start. I encourage all of you, especially those at high risk, to take it. It's safe, and it will protect you, and it will protect also your patients who may get the disease. So I thank you. Get back to you, Dr. Muranga, if there's any batch of questions.
Yeah, thank you, Honorable Minister. We are running out of time, but really those are many questions addressed. I will pose back to the team if somebody needs to ask a question, and then I will make a few 5 more comments that came in, and I think that will be done, unless you allow us to extend the time, but I know there is more demand outside. Anybody who has a burning question?
Mr. Chairman and President John, if I may say something.
Yeah, David, yes, please.
Okay, thank you so very much, Honorable Minister, for clearing most of the worries, and Dr. Muranga for organizing the meeting. The president of the Nursing Association asked, I think, on the shifts for the exposed comrades at the center, and I want to assure him that we have really worked so hard to minimize the time of exposure, and besides that, the coveralls comfort as well. So we have 4 shifts in 24 hours, and they don't actually spend the whole day. I mean, as in, even if it is 4 shifts, you go in, you see the patient, you do whatever the orders you have to do, the vitals you monitor, and then now with the new hospital, we have a very big nursing station where you're not so close to the patients, and after addressing so many of the problems, then you have your own liberty and your own free space. So be rest assured that we have enough space. We have cut the time of exposure for the nursing team as much as the doctors as well. And we have to say that it's unfortunate we lost our colleagues, and but together we shall definitely have to face this. Thank you so much.
Thank you, David. Yeah, so thank you, Honorable Minister. Anybody raise their hand?
Yes, Muranga, can I say a word?
Yes, please. That's Annabelle?
Yes.
Okay.
Thank you very much for allowing me to ask a question. Thank you, Honorable Minister, for your time. So this outbreak has been an occasion for us to reflect on our IPC in daily work, because we have seen a lot of weaknesses all over the years. Like until today, Mutuelle de Santé will be cutting the gloves, and you will see the patients are the one to carry gloves in many districts. The gowns are only being used in theaters. There is no gown in emergency. There's no gown in ICU, HDU, in different area of resuscitation. People are just putting on their white coat and gloves, which can even be not available sometimes. So I think this is the time to talk with insurance, especially Mutuelle de Santé and hospitals, to avail gloves, gowns, those IPC to be used on daily life, not waiting for an outbreak, but also if someone is in ICU should have a gown. If someone is receiving an accident at the ER, should have a gown or something on, not only his uniform and some one pair of gloves, or even not available since you have to wait for the patient to go after paying. So is there a way we can address that like now so that we prevent further losses in the future? That is my question. Thank you.
Thank you, Annabelle. I let Honorable Minister respond, and then we'll take 2 more questions.
Thank you, Annabelle. I think that is not a question to RIS insurance. It's a question to facilities, hospitals, supply chain system. So, and also a question to the users. I think there are basic protocol and practice that have to be enforced, and if the supply is limited or it's not provided, that should be the issue of the person who have not done his or her job. So I want to make sure it's a general issue, or maybe it's a specific in some facilities. But
excuse me, Honorable. What I mean is, like in Kibagabaga, back in the time nkihakora, mituweli irakata ga nyinshi iyo bagiye kwishyura. Baravuga ngo mwakoresheje ga nyinshi, bafite umubare, bafata nka neonatology cyangwa pediatry, bakavuga ngo ga zirenga 6 ku mwana ntibari buzishyure. Noneho niba wanditse 15, 8 ntishyurwa, 6 nizo mituweli. Noneho dafu icyakora ahita abubja ko mwandike 6 muri systeme bakazishyura mbere yo kuzibaha. Noneho ugasanga sometimes urabazi abantu bakibagabaga n'igihe usanga 40% batishyura, mukicara mwabuze ga kubera ko uwo muntu muri kuzituma atari bubashe kujya kuzigura ngo azizane. Kandi iyo dafa zibahaye mbere agahomba, nabyo abirakaremo nyine ntiyongeye kubaha for the next month. So gomba kuba involved ku rwego rwo hejuru, kuko no muri neonatology barakata, no muri maternity barakata, bakavuga ngo no izi ni nyinshi ngo ntabwo turenze 10. Gufata neonatology ukavuga ngo ntabwo uri burenze gloves 10, ngo ntabwo uri burenze katetere 6 umwana w'ikiro kimwe, mituweli iri kwica akazi ku rwego rwo hejuru. Niyo mpamvu nkivugiye hano, kuko ndibaza ko
nacyumvise bivunika, nacyumvise. Iyo clarification wongeyeho ntabwo nari namenye neza niba hari abanga gushyiraho protective equipment ku bushake, ariko niba ari ikibazo cya payment ya mituweli ivuga ngo mwakoreshe byinshi, ubwo biraturuka muri policy. Ubundi ntibagakwiye kuba utari gukora utari kuvura, ntabwo bagakwiye kuba determining uko bavura. I think let's address it from the policy level as well, but if RSSB is on board kuri call nabo twaza kubaha umwanya bakagira comment, otherwise I will personally follow it up. Numva byo gukata ntabwo cyari cyasobanutse mbere. Urakoze Annabelle.
Yeah, thank you, Honorable Minister. Kiros, somebody Kiros Terefe, you still have the question?
Thank you very much. Thank you very much, Excellency. It was really amazing. You know, within a week you got vaccine. Means for me, it's you remember how we were struggling to find a vaccine during the time of COVID. But now within a week we are getting vaccine. By the way, my name is Kiros. I am from Kibogora Hospital. I am gynecologist. His definition, I had a case for gynecologic problem. and she started to have fever, which was with headache and abdominal pain. I suspected, this case may be a case of Marburg, and then I called the responsible people. So how they evaluated was she is not from Kigali, she is from this Minogomero around Kibogora, and she may not be. Then we tested her for malaria became negative, and then they said we don't think she is Marburg. So I was a bit confused. Anyway, finally I just empirically treated her for malaria. She responded. So is there, the Excellency, you were mentioning that there is no specific place which is a risk, and which is not, there is no specific place also which is not a risk. So, and that means even from the cases that we had, the cases even in our country, in Rwanda that we had, there are many cases which were died as a result of probably this problem just even months ago. That means I feel every part of the Rwanda is a risk for Marburg. So it's better to avoid such stratification of cases and just to test which are having high fever and at least, the early clinical manifestation of Marburg. That's what I want to stress, and Your Excellency, your guidance has to be very strong on this aspect so that we can pick all cases, and we will also protect more losses of professionals as well as the community. Thank you for the opportunity. Bye for now.
Thank you, Dr. Kiros. I think you raised a very important point that case definition should be applied across. So it's not a matter of a region or a specific hospital. We could maybe detect something that is not linked to the cluster we are following in Kigali. I will follow up on the response team that specifically followed that case, so that it became also a case for improvement in contact tracing. The good news is that we are establishing a lab in Gihundwe, which might be helping so that whenever you have a suspect case, you have also a testing facility nearby. We're also establishing lab in East, in West, and North to facilitate all these cases, suspect cases to be addressed. All this will begin tomorrow. By Monday, you'll be able to test in each province without coming to Kigali. It's a PCR, of course, it takes some time, but the time to transport samples from all provinces for anyone with fever to Kigali, the national lab cannot handle. That's why even the waiting time has been increasing as we also expand the case definition. So regarding the possibility that maybe this virus has existed before and we didn't know, it's a debate we had. There was several scientific discussions and also within our coordination. But if you look at the epidemiology and the transmission nature of this virus, it's unlikely that in the last 2 months or so have been a virus circulating and healthcare workers were not infected. So the only way to confirm, Elodie, can you mute, please? Thank you. Yaman, Elodie, you need to put your microphone on mute. Thank you. So there are many ways to know that. We're working on it, including detecting some antibodies of people who may have presented similar symptoms in the past and recovered. But most of the time when Marburg is present, it takes at least a month, at most actually a month, before you start to see healthcare workers getting sick. And this is very common to these highly infectious viruses. So the time we started to see healthcare workers getting sick was more or less like the time we started to, unfortunately, some went so quickly into complications and death. So it was unfortunate, but at least the suspicion came in so fast. That's why initially I said at the ICU, where most of these cases are handled with a lot of body fluids and maneuvers that are highly infectious. So we estimate that end August, early September, probably that's could be the time. But before that, months before that, is very, very unlikely. But we continue to do a search. Yesterday, our epidemiology team was looking at mortality data per district, comparing several months with different years and time, and this did not indicate any change until we started to see this situation a few weeks ago in Kigali, Seashika, and King Faisal. So let's continue to do the tracing back and also the sequencing, antibody testing. We may be able to answer this question with lots of assurance and facts. I thank you.
Yeah.
It doesn't matter, Excellency, where it happened. What matters most is the activity being done after you suspected the problem. It's really an amazing job you are doing. We are on your side. Just keep strong, and then I am sure sooner or later we will celebrate the freedom of this virus from this country. Thank you.
Yeah, thank you so much. Yeah, thank you, Honorable Minister, and thank you, Kiro, for that. So, Dr. Peace and then Dr. David Nhirushwa. Dr. Peace first, Dr. David Nhirushwa, and then we will see if Honorable Minister has more time, but we already passed the time he had allowed us. Thank you.
Thank you so very much, Dr. Nkuranga. Condolences to the families that lost their beloved ones, facilities, and our friends that have gone. It's very unfortunate, but we are frontliners. What do we do? I would like to congratulate the Minister of Health and RBC team. They're really trying their best. The response team, they are doing their great job when they are called. Of course, there are lags of time that we're losing, but we understand to some extent they're overwhelmed. We have a few questions. One has been tackled, POT for the results. I'm talking about specific and private sector, where we do not have a big space for isolation, for keeping this suspect. I would really appreciate if we got results as soon as possible. I'm saying as soon as possible. I appreciate the measures put in place. At least it's going to decongest Kigali testing centers. Probably this will improve. It will help us to know the kind of patients we're dealing with, if they are ready to be evacuated or discharged or managed as normal patients. Number two, we were happy to see some recoveries on the update page. I wanted to ask, was there any specific treatment, or it was just natural body mechanism of fighting the infection? So that we say to the luckiest of the lucky have managed to recover. I don't know, probably you allude to that. Another thing is timely involvement of private sector in response to this pandemic or epidemic. We saw this with a lot of frustration with COVID, and unfortunately, still we discovered some gaps. The activation of emergency button does not happen as a whole. The sector is the same, be it public or private, but to some extent you find out private sector, I don't know where we are missing. It is missing somehow, board as soon as possible. The availability of PPEs, the availability of information. I don't know where the gap is, honestly, but probably leaders on this forum will probably shed some light on this. We see some gaps, and it's like it takes a lot of effort and energy to make sure that a facility that is having a suspect is considered, is heard on time, and the correct interventions are done. The other thing is that you talked about coexistence of both malaria infection and Marburg. For the last couple of months, we do not have malaria treatment in our facilities. So we do not know what is being done. I understand it was a crisis across, but when a few doses get available, we do not see us being considered in private sector. I'll give an example. This very week, we got a suspect. We tested everything. We tested malaria, and the patient became positive, but had other symptoms that were really highly suggestive of Marburg. We do not have malaria treatment in a hospital. We had to look around and got doses from King Fahd Hospital. The patient got evacuated with her vials. So could you please shed some light and give us some hope that we are going to get this treatment? Otherwise, we appreciate what is being done, and we are in this together. Frontline we are all facing. Sooner or later, we are going to overcome. Thank you so much.
Thank you, Peace. I'll probably need to get it right in terms of malaria treatment. So you mean in private facilities?
Yes, in private facilities. We don't have artisanal.
So, I mean, I was going to ask details on that, but let me follow up after, because usually malaria treatment you're supplied through the private channels, and if it's from RMS or from public distribution plan. But I'm happy to follow up on that, because I hadn't had that question before. So thank you for raising it. Maybe I can specifically speak about availability of PPEs everywhere. I think private clinics also must be considered, like we did during the COVID pandemic. I can say that yes, we have to provide protections, not just in public, but also for those facilities that are having isolation centers. On the turnaround time, I think the lab issue is cross-cutting. The faster we provide the results, the better. But also I have to mention that when this outbreak started just days ago, there are some systems that we are still activating, like the ones we use in COVID, where results can be collected and sent electronically. You can self-check and all that. So all these have been activated. So I think it will be much faster and having more laboratories as well. So I take this issue very seriously, and our teams. I hope when we meet again, we can meet as frequent as possible. I'm happy to do it on a weekly basis. We can see the improvement on all these areas you are flagging to be improved. I take note also on the speed of response whenever you call, but recognizing that all facilities are calling and the teams are growing, as you can imagine. But we must be responding at the shortest time possible. But since you raise it, I will also bring it to our command post shortly. I saw a question on the asking patients to go to the nearest facility or staying at home. So we are starting a door-to-door check on anyone with symptoms of fever in case. That will be part of our discussion this afternoon. Probably this will answer the question asked on what if people are checked at their household instead of going to facility. But people, if they are sick, they go to facility anyway. That's why health facility must be prepared to do a right triage that doesn't expose patients whenever they present themselves to the facility. You asked about the recovered patients. What treatment did they receive? And what was specific for them? Dr. David, could you help answer that, or Dr. Eric Serianji or Dr. Menelas? They were the one who were on the treatment side. If I'm sure they can answer that more precisely. I think this I tried to cover all your questions, but for malaria specifically, I will call you after this meeting to get more details.
Thank you, sir.
Yeah. And of the clinicians around to provide more clarity, David, or Dr. Meneras, HOD, and Dr. Rick. Honorable Minister will get one of them to come directly. If Dr. David cannot be okay, Dr. Meneras.
Yeah.
Yes.
Yeah.
Okay. Thank you, Honorable Minister. I thought I could give hints of what led to the improvement of this patient. Again, it's very important to ensure that optimized supportive care is provided comprehensively, and we start early, especially the fluid resuscitation, because they have prominent fluid losses, ensuring that we are measuring and correcting the electrolyte imbalance timely. Hypokalemia is very prominent in this patient. It has to be corrected and on time, otherwise they're going to cardiac arrest. The use of blood products, especially platelet transfusion, FFPs, if they are clinically bleeding, and also trending the hemoglobin is very, very key. Management of the fever, and this requires to have access to daily full blood counts and blood chemistry measurements, because you cannot correct electrolyte that you have no vision on it. The use of direct antiviral medication, remdesivir is available everywhere in all the treatment centers, and we use for all the patients. We have no contraindication in terms of liver parameters, because we know the virus is quickly, once it reaches the lymph node, it goes to the liver, you get transaminase in the 3,000, 5,000, 7,000. So don't hesitate to start.
This meeting is being transcribed and summarized.
And also, number 3, there is a mention of the management of the cytokine storm. So far, with the patient that you have managed, we don't see very alarming CRP rising and pointing towards the cytokine storm. So we often tend to fail for the first step of the supportive management. You suspect a case, but you are not already working on their fluid resuscitation. You suspect a patient, you are not already managing their electrolyte imbalance. So this is very, very key. Suspect, measure, and start with the basics before even you think of the complex management, the intubation, the dialysis. When the supportive is very key and started early, we don't end in those complications. Thank you.
Thank you, Dr. Meneras, for that clarity. Much appreciated. Dr. David Hiruswa, I think, yeah, and then we'll hear from you. Okay. If David is not very close to do that, Honorable Minister, among the questions, most of them, they come together on the same really issue. So the summary of the other things, somebody asked strategies for future preparedness. It's a broad question, but mainly was focusing on including healthcare worker safety, insurance, and welfare in such periods of pandemic. I think you had touched on it, but just to shed light how we can move forward. Somebody raised that questions. Most of the others have been raised. But also there's somebody who asked about the safety. I know you had mentioned it very well, but they said they have the trials, the medications that are going to be clinical trials, have they been tried somewhere else? And lastly, there is somebody who asked if healthcare professionals, especially in refugee camps, that was done, if they can also be included into the broader capacity building in terms to mitigation of further and future outbreaks. I think the rest, there is one Honorable Minister important request from one of the participants. He said, could there be a memorial night for the fellows who lost life after we overcome this outbreak? If you could respond to those, Honorable Minister. Thank you.
Thank you so much, Dr. Muranga. I think very good comments and questions, suggestions. Let me start with the last one because it's very important. I think this will be a great idea, and it will be also important if through this network of conversation with the associations of healthcare providers, we came together today. We can have it through this organization. So I think it's a good idea once we this is already handled, or even soon when we are handling at a good stage. So regarding the overall response and preparedness, as you can imagine, everything we are talking about happened within only a week. I would say this is the shortest week I've ever seen, but also the longest, given that every minute there's something, every minute you have to create or think of responding to a need. We will continue to see where the gaps are, where we can improve. But sometimes it's better to have those top 3 tools that help you to achieve 80% of the results expected. To me, the vaccines are always number 1. Testing is very important, but also communication and collaboration is equally important. You may have these tools, but if you are not sharing and communicating, it can be difficult to put them together. It's an evolving thing. It's a new science that we're learning, but also we're contributing to make sure the next disease or threat is prevented and managed timely. So let's stay together, and I'm happy to come to another call, another meeting through this organization. We're going to have a good progress, and I can assure you that, to me, in the next few months, even weeks, we can curb this disease. The early days always are marked with panic, fear, and the increase of cases. But the more we know that these networks of infections, the more we test, and applying this vaccine is going to be protective. And also, in our treatment centers, we've got higher skills, capacity. There are people coming from other hospitals to help. I know Sashibe has sent a team to help in Kigali. We have people from other countries. So everyone who wants to volunteer and help, please reach out through these associations. We can welcome you and your support. Murakoze cyane.
Let's appreciate Honorable Minister. We know there are still many questions, Honorable Minister, but the time is not on our side. This is more than enough of your time, and we truly don't take it for granted. I want to appreciate all members who made time, who contributed, who asked many questions. I will request the moderators to transcribe the questions here, get them so that we capture them and forward it to the Honorable Minister's office, even if they may not be addressed here, but they can inform entire dialogue moving forward, and perhaps can be addressed in one or the other. So it's a very huge, rich information that is being shared on chat here. So I'm asking Dr. Claude and Dr. Deborah if they can download and transcribe any information that is shared for the future use. It's a good, important time. Otherwise, thank you, all of you, and thank you, Honorable Minister, for your time. We deeply appreciate to get back and organize to continue this conversation, even moving in the future, if you will allow. Thank you.
Thank you so much.
Great. Thank you. I'm available anytime you need. Happy to meet.
Thank you very much, Honorable Minister.
Thank you so much.
Merci, merci beaucoup.
Thank you.
Appreciate it.
Thank you so much.
Thank you very much.
Thank you.
Thank you.